Hi, thank you for joining Lily Mae Francis interview on depression. I want to start by introducing myself. I am Lynn Collins Mai. I am the co-founder of Lily Mae Francis Foundation. And what's your name?
Miriam.
And where are you located, Miriam?
I'm in Ohio.
And may I ask your age?
53.
Okay. So if you don't mind, I'm gonna jump right into the questions, okay?
Sure.
All right. First question is, what is your definition of depression?
Um, to me, depression is kind of holding on to the past and not being able to move forward with possibly some of your feelings or anything. You feel down and unable to, I should say, unmotivated, I guess.
Okay.
Um, yeah.
Okay. Your computer's moving a little bit, so I wanna,
Okay.
all right.
Wait a minute.
Okay.
Wait a minute. Let me get it. Okay.
All right. Next question. Do you think most people experience depression from time to time?
I believe so, whether they recognize it or not.
Mhm.
Mhm.
Okay. Do you experience depression? And if so, how do you cope?
I have experienced depression. Um, I guess the best usually what I do is I end up maybe I don't want to say secluding myself, but I try to take time and over the years I learned how to cope with it better. And just knowing that that feeling is not going to last, it's not a forever feeling.
Mm.
So just being able to maybe focus on positive things and not focus on what possibly may have triggered it or just feeling that those feelings that you feel.
Mhm.
So I just try to um change my focus, I guess is the best way to explain it.
Okay.
Just focus on more positive things and looking forward to the future with positivity.
Okay. And so you basically use words of affirmation and things like that to keep you going or to get you out of the rut that you're feeling?
Words of affirmation, and when I think, because I tend to overthink. So when I think about whatever I think about, I try to think about the good things and things to look forward to, happy things, and not. I even kind of you have to pay attention to what you're watching on TV. Like I try not to watch
Absolutely.
anything sad or depressing or
Mhm.
um, hostile or something that'll like emotionally upset me or I may not recognize it at first, but you really should probably pay attention to what's going on around you.
Mhm. Okay. All right. Do you think enough attention and focus is given to mental illness?
No, honestly, I do not. I think lately it's gotten a lot better because at least it's acknowledged,
Mhm.
whereas you didn't hear anything about it. Like growing up, there was a lot you did not hear about. Whereas now there are different programs that people talk about and or at least people are encouraged to seek professional help if you're going through something. So
What do you think is changing that's, making it more conversational now?
I think that more people are talking about it and it's becoming more visible and um so it's becoming, I guess, normalized, I guess. So I think people are willing to talk about it.
Okay. And if you had a friend or loved one experiencing depression or signs of mental illness, what advice would you give?
I would advise them to seek professional help. I'm a good listener, so like if somebody just needs someone to talk to, I offer, to listen and not, judge or even say anything if they are requesting me not to say anything. But excuse me, I'm not a professional, so if there's a feeling that this person, really should seek professional help, that's something I would suggest.
Okay. And so your advice basically is to seek professional help.
Yes.
Okay.
Mhm.
All right. Do you know where to find resources if someone was having a mental health crisis?
Yes. And actually, I guess as far as a one resource as far as the mental health is a hotline that just started not too long ago. Um, can't remember the number offhand. Um, it's something that is is a resource. I've never used it, so I don't know if I could suggest it to anyone. But like the number 988, that's for like suicide and crisis hotline for
Mhm,
people to call. And I mean, I'm assuming that they will get them routed to somewhere that can help them locally.
mhm. So it's safe to say that we probably need to have, as a community, have resources more readily available so that people know, because I don't know that many people know of that number, right? Or,
Right,
and that, I'm sure there are other resources as well that, people could use. So it's safe to say
right,
that we probably, as a community, need to do better.
right.
Okay.
I agree.
Why do you think there is such a stigma attached to depression and mental health in our community?
Because it wasn't, I don't know if it was necessarily recognized
Mm,
as depression or, mental health issues. I don't, actually, let me correct myself. It was not recognized
mhm,
and identified.
mhm,
So I think that part of that may have been the fact that they didn't know what was going on, or they didn't realize that this is an issue. They knew it was different, but not um, an issue to be taken seriously.
mhm.
So I think that a lot of things are downplayed until they're actually brought to the forefront and say, hey, this is an issue, there is help for this or whatever. So I think that just as generations and generations go on, I think it's our responsibility to like bring it to the forefront and give the resources for it.
So let me rephrase it, because
Hmm.
your answer didn't touch the stigma that's associated with it and with mental illness
Okay.
in in our community, right? So I guess yes, maybe it wasn't identified as such, but even the mention or not mentioning of mental
Hmm.
illness could be stigmatized. So I want to dig a little deeper into that.
Um, I guess I would feel like a lack of knowledge about it is probably the why it's stigmatized. And I feel like that with a lot of different things. I mean, if you don't know a lot about something, then it's like, placed in, a special place, or, it's separated or secluded from everything else, And I feel like that that leads to, maybe shame behind it or something like that. So I mean, that's just my assumption. I don't know like a true, why it's like that, but
Mhm.
I guess that's what I'm thinking. Does that answer the question?
Yeah, I think that I wonder, I'm just wondering, when you say shame may be associated with it, right?
Hmm.
Was there ever any mention in the family unit, right, that would make someone feel shame for feeling down or depressed or showing any signs of, things that are associated, symptoms that are associated with mental illness?
Hmm. I don't know. I think maybe just because it's different,
Mhm,
it's not the norm. I think that may be more so. And I mean, like I said, I don't know as far as, when I think about it, it's like, because someone is different, which, back then we may have called someone or classified, or someone was diagnosed as retarded, which now is not a politically correct word, but that was the word used back when we were growing up.
to
And
describe mental illness?
yes, that was one of the things,
Oh,
as
wow.
far as being depressed. That really wasn't, um, in my family, it wasn't a thing, It wasn't anything that I heard about or, heard someone else speaking about it.
Mhm,
It was only in my growing up in my adult life that I think back and I say, oh, I wonder if my grandmother was depressed. I don't know because she's not here any longer, but looking back at it and seeing some of her behavior or the way she thought, I can assume that she was. So the fact that it wasn't even acknowledged or wasn't even identified back then as anything
Mhm, mhm.
is, it wasn't even able to be a stigma, you
Right,
know.
right.
So
Okay.
I don't know.
How do you think we can start having regular conversations as it pertains to mental health in general?
I think that anytime it comes up, it should be a welcome subject. I
Mm,
mean, I think that some people are still uncomfortable talking about it, but I think that the more that it's talked about or the more knowledge that's learned about it, the more comfortable people will be.
mhm,
So I think that any conversation about it should be welcome, and I'm open to it because I'm still learning. I've taken classes and stuff like that, but
mhm,
I still want to know more about it because
mhm.
I think it's ever changing, obviously, and I think that there are different aspects of it that I haven't even come across. So
Okay, so essentially, if people bring the conversations more to the forefront, as well as someone gaining and sharing knowledge, right,
hmm
it would
hmm
make it easier for topics of
yeah.
discussion. Okay,
Yeah, I think it'll become more normalized and more comfortable the more people talk about it and learn about it.
absolutely.
And I think that lately, like the media, you see more things about it on TV and
Mhm.
you hear about it, so and social media too.
Right.
But by doing that, you're giving it exposure. And I think that it's good to have that.
Okay. All right, that was actually my last question. I
Okay.
truly appreciate you participating in our interview today, and I look
Mhm.
forward to hearing some feedback from you, and I'll provide some feedback to you as well.
All
Thank
right.
you for joining today.
Thank,
Bye.
thank you. Bye bye.